Where to start? Alina's absolutely right, and I too have seen the same things. I've experienced the same things personally. I've seen the same things with my family members. And in addition to dealing with low income, with like what your economic status is, we can't skirt the issue about racism. We call it much more cuter, sexier terms now of implicit bias and microaggressions and macroaggressions. It's prejudice and racism was what we all probably grew up with, and it hasn't changed. And so what happens is these judgments are made about people when they first walk in the door. And a lot of times people get blamed for their medical conditions when it's not their fault. And also, I find that when African Americans, I can speak to that definitely, but also other people of color, sometimes seek care, they aren't heard. People just don't listen to them. There is no reason now, and we're in the year 2024, that there are still studies that are being done about perceptions of pain in Black patients, and that our medical students feel that Black people don't experience pain in the same way. And that therefore we don't need pain medicine in the same way. And so if you really believe that, when someone's coming and complaining about pain, then you're gonna label them as drug seeking. Then that follows them through their chart, right? There is no reason that Black women should be dying from childbirth at the rates that they are dying from. And a lot of it is just about listening to people and telling them, like they're telling you what their symptoms are and blowing it off. Side story, I had a friend who was advanced age, but she had a very healthy pregnancy, gave birth to twins. We went to medical school together. And she told them after she delivered that she wasn't feeling well. She's also a physician too. She explained everything. They told her it was all normal. 6 days later, she was gone. She had died. And it's because they did not listen to her. And it's not just about how much money we make either. I think sometimes when race comes into it, money will go out the window. So if you don't have a lot of money, then that just is another barrier on top of that, because we hear about these people who are really rich. Serena Williams is a great example about what she dealt with her first pregnancy and how she wasn't heard too. Money had nothing to do with it. And so I think when we talk about racism or implicit bias or microaggressions in healthcare, we also have to look at who is providing the care. Because if we don't have people like Matt who are in the room, who actually look at those things very honestly, we know there are people who look like the people who need to be served. And the numbers are just very, very stark. And they've been stagnant for years. For African Americans physicians, we barely get about 6%. I think we're like in the 5% range. And I am completely a unicorn, as I'm just over 2% of the number of doctors. Black women make up only about just over 2% of all physicians in this country. So when you don't have people who are caring for the people who are ignored, therefore those people don't like to go get health care because they don't feel like they are trusted when they're going to seek care. And then this is just perpetual cycles.